The standard schedule for vaccines has been well researched and well documented with lots of good scientific studies. I think the difficulty with the alternative schedules is that there is really no science behind them. There's no good proof that the alternative schedules really are effective. We know that the standard schedules are effective because they've been well researched. So the alternative schedules, it's possible that they work, but there's no science behind them. So we want to go with hard science, and I think that helps us make good decisions about what's best for kids. A couple concerns that parents have to do, number one, with autism, and I think there was a scare that was created by Wakefield from England, and I think that myth has been debunked, and I think there's plenty of evidence now that vaccines are not associated with autism. Autism is a serious concern, obviously, but it's not associated with vaccines. And the other concern parents have has to do with the number of vaccines that kids get and the perception that maybe we're giving too much. But if you look at the amount of protein or antigens that each child is receiving, it's actually dramatically less than it was 20 years ago, even though it looks intimidating because of the number of shots kids get. But the actual load to their immune system is actually much less than before. I have enough gray hair that I am old enough and doing pediatrics for 38 years now that I remember some terrible vaccine-preventable diseases that we no longer have, particularly bacterial meningitis, which basically has been eliminated thanks to the Hib vaccine. So I think that's really an important perspective that I can offer. The other thing I always mention to parents in the office is that the vaccines that we recommend for the children with whom we're entrusted to care for, those are the same vaccines that my 4 grandchildren get. So there's no double standard, and I wouldn't recommend anything for kids in the office that I wouldn't recommend for my own precious grandchildren. Besides the obligation that we have to protect individual children, I think we as a community and we as pediatricians really have a serious commitment to our community at large and the importance of what we call herd immunity. So if we don't maintain high vaccination levels in our community, there are more children that are vulnerable and the spread of diseases is enhanced. And in our practice, we have a handful of children who are on chemotherapy for bad diseases, and if they get exposed to somebody with a communicable disease who's unvaccinated, it could be absolutely devastating for those children. So for those special children, but just for our community at large, it's really important that we maintain a high level of immunization status in our community. I think it's a wonderful thing to feed children healthy food, avoid processed foods, eat organic food whenever possible if it's affordable. But I think we need to, in addition to that, really maintain good vaccination rates for our community. I think people who don't vaccinate and whose children don't get sick are lucky, similar to people who ride in a car without a seatbelt and get in an accident and do okay. We know in the same way that it's always safer to vaccinate children, and I think we all have an obligation to one another to care for each other and to care for our community, and the herd immunity for schools and playgroups and families is really, really important. And unless we do that, we're going to have unprotected children. Vaccines are really important. They are the bread and butter, the heart of pediatrics, and we as pediatricians are totally committed to vaccine preventable diseases and doing whatever we can to protect our individual patients, but also our community at large.